What is route of drug administration? A route of drug administration in pharmacology and toxicology is the path by which a drug, fluid, poison, or other substance is taken into the body. Routes of administration are generally classified by the location at which the substance is applied. Factors affecting route of drug administration. First, physico-chemical properties of the drug, onset of action required, type of response required, site of desired action, nature and formulation of drug, circulation at the site of absorption, biotransformation, and condition of patient. Enteral is the drug placed directly in the GI tract. Examples are oral, sublingual, and rectum. Oral is the administration of drug by ingestion. The advantages of oral route can be self-administered, pain-free, and easy to take. Absorption takes place along the whole length of the GI tract. The drug's preparations needs to sterilization. Both solid and liquid dosage forms can be given through this route. Most suitable route for GIT infections and GI parasites, and cheap as compared to most other parenteral routes. The disadvantages are drug action has lower onset, not suitable in case of emergency. The drug absorption is irregular and unpredictable due to the presence of ingesta. The first pass effect is the drugs absorbed orally are initially transported to the liver via the portal vein. The irritation to the gastric mucosa is the nausea and the vomiting. The first pass effect is the term used for the hepatic metabolism of a pharmacological agent when it is absorbed from the gut and the liver to the liver by the portal circulation. The greater the first pass effect, the less the agent will reach the systemic circulation when the agent is administered orally. Sublingual or buccal route is the drugs are taken as solutions or smaller tablets which are held in the mouth or under the tongue. The advantages: rapid absorption, drug stability, avoid first pass effect. Disadvantages are inconvenient, small doses, and unpleasant taste of drugs. The rectal route of drug administration is unconscious patients and children. If patient is nauseous or vomiting, easy to terminate exposure, absorption may be a variable, and good for drugs affecting the bowel such as laxatives.
the following are the examples of the parenteral route of drug administration. So it means any non-oral means of administration, but it is generally interpreted as relating to injecting directly into the body by passing the skin and mucous membranes. So first, we have intravascular. So there are two types, the intravenous and the intraarterial. So the absorption here, the absorption phase is bypassed. So it means 100% bioavailability, or the proportion of a drug or other substance that enters the circulation when introduced into the body and so is able to have an active effect. So it is precise, accurate, and almost immediate onset of action. So large quantities can be given fairly pain-free. So the greater risk of adverse effects, here are the following. First is the high concentration attained rapidly. Next, the risk of embolism, or the lodging of an embolus, a blockage causing piece of material inside the blood vessel. So the embolus may be a blood clot or thrombus, a fat globule rather, a bubble of air and other gas, or gas embolism, or foreign material. So an embolism can cause partial or total blockage of blood flow in the affected vessel. Intravenous route of administration. So here are the procedures. First, pull back the plunger in to identify that the needle is in a vein, so a small amount of dark red venous blood should trickle into the syringe. Next, inject slowly to reduce the likelihood of damage to the vein and to lower the overdose risk. So remove the needle slowly, but if the needle is removed too quickly, the vein may collapse. So immediately apply pressure to the site bruising is caused by bleeding into the surrounding tissues. So immediate firm pressure will limit the amount of bruising caused. Some medications must be given by an intravenous injection or infusion. So this means they're sent directly into your vein using a needle or tube. In fact, the term intravenous means into the vein. So with IV administration, a thin plastic tube called an IV catheter is inserted into your vein. So this catheter allows your healthcare provider to give you multiple safe doses of medication without needing to poke you with the needle each time. So in most cases, you won't give yourself an intravenous medication. While you can take some infusion medications yourself at home, you'll likely receive your therapy from a healthcare provider. Shown here are the advantages of the intravenous route. So it has quick onset of action. This route is used when precise control of the drug effect is required. So highly irritating and non-isotonic solutions can be given by slow IV because dilution provided by circulating blood. So large volumes of fluid can be administered through this route. Other advantages are it allows rapid and more predictable delivery of drugs. So in some drugs, it allows higher doses that would be tolerated orally. So it bypasses also the first pass metabolism, and it is not dependent on the gut function or muscle perfusion. It allows also the administration of large volumes, for example, the intravenous fluids. So the disadvantages of intravenous route. So this route required special technique. Air embolism may put life of animal in danger. So when an air bubble enters a vein, it's called venous air embolism. These air bubbles can travel to your brain, heart, or lungs and cause a heart attack, stroke, or respiratory failure. So extravascular accumulation of irritant drugs may cause necrosis, a form of cell injury which results in premature death of cells in living tissue, or peripheral tissues and phlebitis. So, or it means inflammation of a vein. So, extravasation of medication during IV therapy is an adverse event related to therapy that, depending on the medication, amount of exposure, and location, can potentially cause serious injury and permanent harm such as tissue necrosis, as I've said earlier. So lastly, it is not suitable for insoluble drugs like oils and suspensions. Let us now go to the intramuscular route of administration. The drug is injected deep between the layers of one of large skeletal muscle because these are richly supplied with blood and less with nerves. So this route is used for providing systemic effect of drugs. In medicine, it is one of several alternative methods for the administration medications. Because muscles have larger and more blood vessels than subcutaneous tissue, and injections here usually have faster rates of absorption than the subcutaneous injections or the intradermal injections. So depending on the injection site, an administration is limited to between 2 and 5 milliliters of fluid. The advantages of intramuscular route. It is the route of choice in animals. It is very rapid absorption of drugs in aqueous solution and oleaginous suspensions. So the absorption of drug is rapid except for oily and depot preparations. So the duration of action is longer than for IV injection, but usually a little shorter than for subcutaneous administration. It is mostly suitable route for fractious, wild and zoo animals which may be difficult to restrain. Other advantages are it is useful in neonates with little muscle mass, and it is less painful route for frequent injections, and immediate access to cardiovascular system. Here are the disadvantages of the intramuscular route. So large volumes of fluids cannot be injected, unlike in IV route. And there is a possibility of improper deposition of drug in nerve, blood vessels, fat or connective tissues. Plus, it is not suitable for emergency situations because conditions like cardiovascular collapse or shock may impede absorption of drugs. The subcutaneous route of administration. The drug preparation is deposited into the loose subcutaneous tissue under skin. It is richly supplied with nerve but less blood supply. So the advantages are large volume of non-irritating drugs may be administered. Absorption of drugs is slower compared to IM and IV. So it is suitable for depot preparations. The disadvantages, it is not suitable for irritant drugs. So a subcutaneous injection is administered as a bolus into the subcutis, the layer of skin directly below the dermis and epidermis, collectively referred to as the cutis. So subcutaneous injections are highly effective in administering vaccines and medications such as insulin, morphine, diacetylmorphine, and goserelin. Intradermal route of administration. The drug preparation is injected in the dermis of the skin. Injection is applied on the skin of most sensitive part of the body. Advantages. Used for diagnostic purposes like tuberculin test, Mallain test, antibiotic sensitivity test. Disadvantage, it has painful condition. So this route has the longest absorption time as compared to the subcutaneous injections and intramuscular injections. As a result, it is used for sensitivity tests, as I've said earlier, like tuberculin, an allergy test, and also for the local anesthesia. So here are the different angles of different types of injections. In intramuscular, it should be 90-degree angle, and subcutaneous injections 45-degree angle to avoid pressure on sensory nerves causing pain and discomfort. Lastly, intradermal, it should be 10 to 15-degree angle. Intra-articular injection. It is used to inject the drug in joint. For the treatment of arthritis, more skill is required. So it has painful application and it might damage the cartilage. So the utilization of the intra-articular route for the delivery of drugs and other macromolecules has recently evolved, making use of the avascularity of the cartilage tissue to allow regional administration of the drug within the joint space rather than the systemic circulation. Intraperitoneal drug administration. So it is the injection into the peritoneum or the body cavity. So IP injection is more often applied to animals than humans. It is generally preferred when large amounts of blood replacement fluids are needed, or when low blood pressure or other problems prevent the use of suitable blood vessel for intravenous injection. So repeated administration results in peritonitis. Surface area is larger, So it is used in case poisoning. Advantages. So just to make it short, it has a rapid absorption due to the large surface area. One of the disadvantages is painful and risky. Let's say, for example, dialysing, fluid poisoning, and renal failure in lab animals. Intracardiac injection. Drug is injected directly into the heart. So injection can be applied to the left ventricle in case of cardiac arrest.
Epidural injection is the injection in the epidural space, which is located in the spine between the vertebrae and the dural sac, which surrounds the spinal cord. Intrathecal injection is the drugs which cannot cross the blood-brain barrier that are administered through this route. Shown in this picture is the example of the intraosseous injection.
Extravascular route. First is the inhalation. So gaseous and volatile agents and aerosols. Rapid onset of action due to rapid access to circulation. So it has large surface area, thin membrane separates alveoli from circulation, and high blood flow. So the advantages of this are parenteral route is rapid, as I've said earlier. It has the rapid access. So it is useful for uncooperative patients. It is useful also for unconscious patients. So inactivation by GIT enzymes is avoided. First pass effect is also avoided. And the bioavailability is 100%. But the disadvantages are skill is required. It is painful. So this method is expensive and it is less safe. If it is hypospray or jet injections, that type of inhalation. So the following are the example of the topical route of drug administration. So this refers to external application of the drug to the surface for localized action. So first is the skin. Drug is applied as ointment, cream, lotion, paste, powder, dressing, etc. Another example is bath. It is immersion of the body in medicated water. Then dips, it is type of bath in which body is dipped in medicated fluid for a certain time. Another examples of topical route is injunctions and dusting. So in injunctions, it is the application of semi-solid or liquid drug on the body by rubbing. So it is the form of rubbing of ointment or oil into the skin. Then lastly, dusting. It is the application of fine particles of solid on surface of the body. So shown in this picture is the application on mucous membranes. So we have specialized drug delivery systems. Transdermal drug delivery system are topically administered medicaments in the form of patches that deliver drugs for systemic effects at a predetermined and controlled rate. So transdermal is a route of drug administration wherein active ingredients are delivered across the skin for systematic distribution. So examples of this include transdermal patches used for medicine delivery. Lastly, the liposomes. So liposomes are minute vesicles of lipid bilayers enclosing and aqueous compartment. So they are utilized for the transportation of drugs to areas not normally accessible to free form of drug. So liposomes can be used as an anti-TB nanocarriers for the treatment of both pulmonary and extrapulmonary TB. However, the success of therapy is highly dependent on the administration route of these nanoparticles. So since liposomes are vulnerable to intestinal lipases, their administration needs to be performed by other routes different from the oral route. So the intravenous administration for TB treatment is compromised by several factors, such as leakage of liposome contents in the plasma compartment before reaching the target tissue. So rapid clearance from the bloodstream and liposome uptake by macrophages of the liver and the spleen.